and screening in men. This is Adebuzala Onwumin, DNP. I just wanted to let you know that the content provided in this presentation is for informational purposes only. The content is not medical advice. Please consult with your medical professional for an individualized plan for personal health issues. The objectives are to explain the components of preventive visits for men, to understand preventive care and screening by age, and to understand how to seek preventive care and screening. Life expectancy in men is 75 years, while for women 80 years in the USA. For Black men, it's 71 years, while for African men, E.G. Nigerian men, it's the early 60s. 55% of men do not go for a checkup, USA. Why are men resistant to checkups? Reasons include I have no insurance. I don't want to know. I would rather do house chores than go for a checkup. I feel okay. I know what I'm doing. Everyone will die one day. And I'm too busy. Why do we screen? To prevent disease, detect early, and maintain quality health with age. For men ages 20 to 40, get a physical yearly, dental every 6 months, and an eye exam every 1 to 2 years. Get your blood pressure, blood glucose, cholesterol, thyroid, urine, blood chemistry, blood count, and weight checked. Self-examine your testicles monthly. Abnormal testicular findings can warrant further testing. Baseline sexual transmitted testing should be done. For most men, a mental health assessment should include screening for anxiety and depression. Vaccines include yearly flu, T2P, COVID, and HPV up to 45 years. For men ages 40 to 50, get an annual physical, dental every 6 months, and an eye exam every 1 to 2 years. Get your blood pressure, blood glucose, cholesterol, thyroid, urine, blood chemistry, blood count, and weight checked. From the age of 40 and above, men's prostate gets enlarged. Therefore, men 45 years and over with average risk should have their prostate checked. Also, people aged 45 and older with average risk should undergo colorectal screening. However, if you are at high risk, you could get screened sooner. For men 50 plus, get an annual physical, dental every 6 months, and an eye exam every 1 to 2 years. Get your blood pressure, blood glucose, cholesterol, thyroid, urine, blood chemistry, blood count, and weight checked. You can be screened for skin cancer. Even though rare breast cancer can occur in men, report any abnormality to your healthcare provider. No routine screening for pancreatic cancer in the average risk population. If you are at high risk, get screened. If you have smoked 1 pack of cigarettes a day for 20 years, you could develop lung cancer, so get screened. However, other circumstances can put non-smokers at risk of lung cancer. Testosterone screening can be done with a declining hormone. Immunization starting at age 50 includes the shingles vaccine. For men ages 65 and over, get an annual physical, dental every 6 months, and an eye exam every 1 to 2 years. Get your blood pressure, blood glucose, cholesterol, thyroid, urine, blood chemistry, blood count, and weight checked. Osteoporosis screening. Bone density scans for the high-risk population can be performed every 1 to 2 years. A hearing test can be performed every year. Immunization starting at 65 years includes the pneumococcal vaccine. For more information on genetic screening for cancer, ancestry traits, genetic mutation, and so on, contact the National Society of Genetic Counselors website. Up to 80% of chronic disease and untimely death can be prevented with a healthy diet and regular exercise. A healthy diet involves limiting cholesterol, especially saturated fat. Limit red meat, saturated fat/oil, cheese, egg yolk, fried food, fried chips. Grilled/baked skinless chicken. Fish is better. For iron-rich foods, beans, lentils, tofu, chia, and nuts are better options. Limit salt, for example, salty fish and salty snacks. For carbs, limit white rice, white bread, and pasta. Whole wheat bread and brown rice are better alternatives. Portion control will help reduce carb intake. Vegetables such as spinach, kale, collard greens, and spring mixed salads provide your body with micronutrients and fiber. Consume water instead of juice, soda, and malt drinks. Limit alcohol to 12 ounces of beer daily or 4 ounces of wine daily or 1.5 ounces of 80% proof spirit or 1 ounce of 100% proof spirit daily. Exercise involves 30 to 60 minutes of daily moderate intensity exercise that breaks a sweat. Inclusion, a reactive attitude to health, equals a poor health outcome. You have only one body. Treat it as the temple of God. Thank you for listening. For comments and questions, I can be contacted at AO Family Health through email aofamilyhealth@gmail.com and telephone number 908-251-95892.